How do I heal from bipolar disorder and depression? I'm a clinical psychologist and let's break this down. First of all, depression and bipolar are two distinct disorders in the Diagnostic and Statistical Manual of Mental Health Conditions. Depression comes under depressive disorders and bipolar comes under bipolar and related disorders. They are both mood disorders but are quite different. Depression, there are a few different types. You can have major depressive disorder, which is basically low mood for a minimum of 2 weeks, fatigue and a loss of interest in activities you used to enjoy, feeling hopeless. And bipolar can be bipolar 1, which has major depressive disorder, which I just described here, and mania. And bipolar 2 has hypomania, which is a less severe form of mania, and major depressive disorder. And yes, you can have bipolar 1 with no depression in it. Now, the first thing you need to do is obviously see a psychologist and a psychiatrist to understand whether medication might be right for you when it comes to bipolar disorder. Bipolar disorder is very brain-based and the mood changes can often be unpredictable and not triggered by anything specifically. Whereas depression or borderline personality disorder, the moods are often triggered by an external event, a friend not texting you back or getting rejected from a job, whereas bipolar is very brain-based, so that's why medication can play such an important role. What's really important in both disorders is making sure you have the basics. You're getting enough sleep, because lack of sleep, not eating right, having substances or alcohol can trigger manic or hypomanic episodes. So you want to make sure with any mental health condition, do you have the basics? Are you getting enough sleep per night? Are you eating regularly, drinking water? And exercise is a huge part of depression. It doesn't have to be huge, extensive exercise. Even just a walk a day for 7 minutes has been proven to boost your well-being. Once you've got that in check, then I would attend therapy and do some sort of cognitive behavioral therapy. CBT aims to change your thoughts because your thoughts control your feelings. If you constantly think, I'm worthless, I'm useless, there's no point in me being here, you're going to feel low, and when you're in a low state, your actions are going to follow. Either you're going to self-soothe with food, drugs, alcohol, avoiding scrolling on social media, but you're not going to engage in very adaptive behavior. Now, people try to change the behavior. They try to change the binge eating or the alcohol use, but these are actually coping modes. What you need to do is change the thoughts that lead to these behaviors. So start to see your worth, start to challenge these beliefs, start to realize that thoughts are not always facts. And even if they are facts, because I know what you're thinking, but Steph, I don't have a job, it's not helpful. So the goal is to align your thoughts with the type of life you want to live, and that aligns with your values and your vision. Got a question on psychology? Let me know in the comments.